Lines at times stretching around the block. People hoping to get their first dose of the monkeypox vaccine.
I am frustrated and I get really anxious because, you really want to get this vaccine, especially because the cases are getting higher and higher.
City officials adding vaccine centers, opening 3 more locations over the weekend. But appointments for the 2-dose vaccines are hard to get.
It's been really difficult to find an appointment lately.
The numbers are still small, but clearly growing. The 618 total cases reported up until Monday in New York City, almost double the total cases reported just last Wednesday. And health officials say the current estimate is likely an undercount. So far, gay and bisexual men have been the group most affected by the virus, but anyone can get it through skin-to-skin or mouth-to-mouth contact. In New York City, vaccine eligibility is limited. Only men who have sex with men or anyone with multiple or anonymous sex partners in the last 2 weeks can get the shot, according to the health department. How are you feeling about the rollout of this vaccine and the spread of monkeypox in New York?
It's a mess.
Along with a lack of vaccines, there have been familiar problems of online portals crashing.
I feel like in this day and age, we shouldn't have portals, crashing because of the amount of people logging in to make appointments, especially after what just happened with COVID.
The city's health commissioner responding Sunday.
I understand frustration. We're frustrated with the amount of supply that we have of this vaccine. We need to get shots in arms as quickly as possible, but we also need to ensure that equity is built in from the beginning, and that's what we're trying to do now.
New York City, not the only place impacted by the virus. 43 states have at least 1 case, according to the CDC, including Connecticut, which announced its 13th today.
We're still short of vaccines, but we do have some vaccines, more coming right now.
Back in New York, some people coming to get the vaccine from out of state.
I also think that messaging needs to balance targeting the communities who are most affected by monkeypox, which right now is, gay, bisexual, other men who have sex with men, without stigmatizing those communities. It's a very fine line, but I think we need to do a better job of walking that.
For the people who've caught monkeypox, the symptoms vary from fever to exhaustion to a very painful rash. We met a gentleman who has 3 friends with confirmed cases and another who has a friend with all of the symptoms but hasn't been able to get an appointment at a doctor's office. It's really underscoring just how challenging the system has been and how likely it is that we're looking at an undercount.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.